अस्सलाम वालेकुम जी। डॉक्टर रेहान उमर के साथ एक मरतबा फिर छोटे से वीलॉग के साथ। अक्सर मेरे जो कॉलीग्स हैं, जो फ्रेंड्स हैं, पेशेंट्स हैं, वो मुझसे पूछते रहते हैं डॉक्टर साहब कि आप जो है डायबिटीज़ पे इतना एम्फेसाइज क्यों करते हैं डिस्पाइट ऑफ द फैक्ट दैट यू आर एन इंटरवेंशनल कार्डियोलॉजिस्ट। तो मेरा उनसे बड़ा सिंपल सा आंसर होता है कि देयर इज़ अ वेरी थिन लाइन बिटवीन कार्डियोमेटाबॉलिक डिसऑर्डर्स and one has to delineate and understand and try to find out that thin line, because diabetes per se is one of the root causes of cardiovascular diseases. Patients with diabetes, they don't die of diabetes per se, they die of because of complications of diabetes, among which cardiovascular diseases are the number one cause. Diabetes, is pandemic nowadays across the globe, in general, in Pakistan in particular. We are, in fact, the number one country in the world as far as the prevalence of diabetes is concerned. We are number three as far as population is concerned after India and China. But the graph is going steeply high, and we need to take good control of that. And we know in patients who've got diabetes, most of the time when they come to our clinics, they land up with both micro as well as macrovascular complications. And in order to prevent uh, uh, the onset of acute coronary syndrome or advanced cardiovascular diseases, we need to have a very good control of diabetes per se, their numbers, their complications, everything has to be taken care of. Uh, in any patient who has diabetes and who comes to me with for his management, the first thing that I look into is his blood sugar numbers, and then his 10 years risk of developing atherosclerotic cardiovascular diseases. I would love to see, and I do that, his renal profile, kidney function, his lipid profiles, his cholesterol numbers, LDL cholesterol, HDL cholesterol, triglycerides per se, and non-LDL, HDL particle numbers as well, because all these play a major role in the development of cardiovascular diseases. Apart from that, I always try to control their blood pressures. But after having said that, the first and foremost important aspect of management of patients with diabetes is uh, we need to have to look at the patient holistically, how the patient behaves, what is his body habitus, is he obese, thin, chubby, what is BMI, what is his waist hip ratio, what is his waist height ratio. And then we try to optimize his diet by asking questions, whether his preferences. We don't want to starve the patient. We need to find out about his food preferences and then try to modify their food and lifestyle. Then we take care of his micros and macros, the quantity of protein, carbohydrates, fibers, fats, fluids in his diet. After that, I just get his baseline profile, and then after managing all these principles, all these management protocols like cholesterol, blood pressure, I advise him a good lifestyle plan, which is of paramount importance, and which the ADA, ACC, AHA, EASD, all these different societies have proposed unanimously that every patient who has got diabetes should have to have 150 to 180 minutes of lifestyle modification principles. That is healthy lifestyle, walking, brisk walking, running, jogging, weightlifting, swimming, etc., where he has to do those things in order to prevent or delay the onset of complications. Then my protocol is that I always try to assess the ASCVD risk calculator. If the patient is less than 40 years of age, I try to find out his lifetime risk of developing ASCVD or atherosclerotic cardiovascular disease. If he is more than 40 and less than 70, I look at his 10 years risk of developing ASCVD or atherosclerotic cardiovascular disease, or stroke for that matter. And if the results are moderate, I try to put him on good doses of statins. I discuss with the family. And if the risk is high, I just go higher up and give the patients high dose of statins. There are patients who have got fear of statins, and to them, I tell them that 9 out of 10 patients, they don't have to be scared of statins, because statins are wonderful drugs. But even then, if they're scared, if they have symptoms of myalgias, after ruling out the pathophysiological causes of myalgias, and let's rule out the possibility that statins are responsible, I counsel them. And if still they are convinced that statin is the sole drug which is causing problems, I try to decrease the dose of statin or change the statin, or for that matter, add them up with either ezetimibe or bempedoic acid. And mind you, I've got mind-blowing effects with bempedoic acid and ezetimibe on top of statins, bringing down the LDL cholesterol, which is the major player in the development of ASCVD, to less than 55 milligram percent. So these are different parameters that I advise my patients with diabetes so that they can postpone or delay or prevent the onset of atherosclerotic cardiovascular disease. And I think each and every one of my healthcare professionals belonging to my community should look into this aspect of management. Thank you very much.